New research from the University of Sydney shows mental health disorders among young Australians have reached their highest levels on record. The study found more than 1 in 3 young people now meet the criteria for a mental health disorder, with anxiety and mood disorders more than doubling since 2007. Joining me to discuss this afternoon is the lead author of the paper, Dr. Louise Birrell from the University of Sydney. Dr. Louise, thanks for coming in this afternoon. These figures are pretty concerning. It's quite remarkable. What stands out to you the most?
I think what really stood out to us was that it wasn't just mental disorders that increased, they'd also increased in severity, complexity and impact. So we saw suicidal thoughts doubled, we saw that it was having a larger impact on young people's ability to study, work and learn.
Okay, how much of this is an increase in reporting versus actual cases?
Look, I think we do see that young people today are more likely to talk about mental health, which is a really good thing, but it doesn't explain the size and the severity of the increases that we saw. So it's part of the puzzle, but can't explain the large increase and particularly the increasing severity and complexity.
Okay, what are we talking about in terms of mental health disorders? How does that present?
So the most common type of mental health disorders that we looked at were anxiety disorders. So this is characterised by excessive worry, fear that's out of proportion to the situation and interferes with day-to-day life. So we have different types of anxiety disorders: social phobia, fear of social situations, obsessive compulsive disorder and generalised anxiety disorder are the most common.
And are these disorders where in the past they weren't given names as such, or they weren't diagnosed as much?
So look, we looked at national survey data across 15 years that used exactly the same diagnostic instruments. So we were looking at comparable rates using the same types of survey techniques that diagnose conditions amongst the whole of the Australian population. So we're confident that these findings are real increases in mental health disorders across the Australian population for young people.
Okay, you spoke about the numbers don't explain the reasons. So what are the potential reasons? What is causing this huge number of people with concerns?
Yeah, look, that's a really key question. It's something that our data can't answer, but what's really important is to talk to young people. And when we do that, they talk to a range of pressures that's impacting their mental health. So it's unlikely to be a single cause, but they point to things like increasing insecurity, housing insecurity, financial insecurity, the global climate crisis, as well as the double-edged sword of digital media. They talk about digital media being both helpful in terms of accessing information about mental health, but it can also be harmful.
Yeah, it's a changing world, isn't it? Dr. Louise Birrell, thanks for coming in. It's very interesting. Thank you.
Thank you very much.